Coronavirus cases continue to soar upward in St. Charles County. Healthcare workers voice what it's like on the front lines and call for all residents to help stop the spread.
Obviously, COVID-19, coronavirus, it's a virus unlike I've ever seen, in so much as people are getting sicker and sicker and sicker rather over time, rather than getting better. So we're seeing a lot of patients who tested positive for COVID a week prior, and they're at home, and then suddenly they get very ill a week later. Whereas, with the flu, you get sick, you kind of stay sick for a couple days, and you start to get better. With COVID, I'm seeing patients who feel okay for a little bit, for a week, and then they come in and they're very sick, and then they're critically ill. And they just keep getting sicker and sicker and sicker, and it's hard for us to get them better.
So in the last few weeks, as the numbers keep rising, we are, number one, running out of staff because staff is getting sick. So we are, we have full capacity of beds, patients in beds right now, coming in with shortness of breath, fevers. The symptoms are so sporadic with COVID. We're really just, filling these beds with people and testing them. So nurses are getting sick as well. Hospital numbers, we have a unit full now of COVID patients. We had to open the whole half of the floor. The patient numbers are going up in the ICU again with intubations. Patients are on BiPAP and high flow oxygen again. I think it's almost getting as worse as it was the first time around.
Almost every day it's like max critical staffing. We are being pushed to our limits as far as patients to nurse ratios, as far as how many patients are on the floors. We are holding in the ER because there's not enough beds in the hospital to get these patients that are waiting for beds. We're opening up, like Kate said, extra units that we don't have necessarily the staff for. So it's just going to keep revolving if we can't get a hold of this and go back to how serious we were about it at the beginning of the year.
Professionally, it's exhausting working here. Saturday night I worked close to a 20-hour shift because we had nurses not show up to their shift, and it is just mentally exhausting and physically exhausting.
COVID patients, they need more. You have to put a mask and a gown and 2 pairs of gloves, and there's so much more that goes into taking care of a COVID patient. And when you're in there, all you're thinking is am I safe? Am I safe from this virus? Because do we really know? We know a lot, but we don't know everything. This is a new virus, so it's very stressful.
When we work our tails off here at work, and then we're leaving here and we see people at the grocery store without masks on or saying that COVID isn't real, it's definitely, it's a different world inside the hospital doors, and a lot of people don't see what's going on, and it's absolutely heartbreaking.
Even if it's a little annoying, or you feel like you can't breathe, or some people tell me, I get a runny nose when I put a mask on. Well, you're just doing it to go into the grocery store. So do it for us, because if you do it and we are able to spread COVID slower, then that means that we won't be as stressed out at the hospital. We won't be seeing as many patients. We won't have to stress about taking it home to our kids. So do it for us.
If we can try and go back to the way we were and how serious we were back in March, April, May, you could potentially keep one of your loved ones alive.